Interdenominational Health Ministry Coalition, well, it's a group of churches, faith-based organizations, community partners that have come together to help people really kind of learn how to manage their own health so that we can change these dismal outcomes that we have, change the health disparities that are really affecting us, particularly people of color.
I've been involved with IHMC in that I am one of the coordinators at Antioch Baptist Church for the blood pressure project that we're running, and also for the health ministry. When the opportunity came to participate with this project, I jumped on it with all hands on deck, because I think it's very important that we as African Americans know what is it that's killing us. We don't have to die from these diseases.
Our tagline is health is a spiritual matter. And so we say to people of faith that because it's a spiritual matter, it is something between you and God.
A healthy lifestyle starts at home and it continues through our ministry. Having a health ministry in my church has affected me in the sense that I am seriously aware of what goes inside of this temple. I work out on a daily basis. I make sure that I eat as healthy as I can.
It has brought great awareness to our congregation as a result of being affiliated with IHMC. We have the opportunity to have a health and wellness ministry at In Christ New Hope Ministry. We do monthly blood pressure readings. We do nutritional seminars. We also have planted a garden on the church premises.
First things we ask them to do is get permission to do a health minute. And so that health minute goes up on the screen on Sunday, and they take a Sunday and they do blood pressures after their church service. It's a good way of getting them into the idea, getting the congregation used to the idea that this is health ministry.
We have a motto in our support group: each one, teach one, bring one. As a vendor, I was able to share information about scleroderma to participants in the various events that IHMC offered. As a participant in IHMC meetings, I get the opportunity to learn a lot from other participants. So it's helping me to grow as an individual and allowing me to take some of that information back to the support group that I am a support leader of.
Health ministries can bring a better understanding of trauma to the ministry by having individuals who specialize in faith-based trauma treatment to present healthy information about trauma and how trauma impacts individuals within their congregation.
We want to help them understand how they can respond to those people that come into their fellowship that have been impacted by trauma. Post-traumatic stress with war veterans, women that have had sexually assaulted, those children that have been abused. How do we respond to them?
I'm inspired by seeing the changes that a person can experience over time. I think it's fantastic that we can share this information, we can experience these changes, and as a community we can get better.
We are realizing that health care cannot be contained within the physician's office, that we've got to bring it out where people live, where they work, where they pray, and where they play. We really see this expanding wherever people want to change the outcomes of those health issues. That's the goal, is to reach everyone with this message that health is a spiritual matter and you can make a difference.